detecting signs of disease, you and your health. An adequate examination of the pelvic organs requires the use of special instruments. Inflammation of the bladder will make itself known by symptoms, but if much information about the organ or about a possibly enlarged prostate gland is to be obtained, a cystoscope must be used. As a rule, cystoscopic examinations are made by urologists, specialists in the diseases of the urinary organs. All doctors, however, can and should do simple rectal and vaginal examinations. In a man, the general condition of the prostate gland can be judged by palpating it with a gloved finger inserted into the rectum. But simple palpation gives little information about the condition of the rectum itself, the lining of which must be seen if its condition is to be determined. In rectal examinations of both men and women, a sigmoidoscope is used. This is a comparatively large caliber open-end tubular instrument 8 inches or more long, with an internal light to illuminate the tissues. This is inserted slowly into the rectum until the sigmoid bend in the colon is reached. This enables the doctor to see and examine the entire area of the lining membrane of the rectum. By such examinations, many clear early cancers have been discovered, as well as polyps and other benign tumors which might become cancerous if not removed. Internal hemorrhoids can also be seen by such an examination. A mistake once common was to examine for hemorrhoids only, leaving other areas of the rectum and colon uninspected. It is true that hemorrhoids are much more common than rectal cancers, but cancers are much more serious, and no opportunity of discovering them or other growths which might become cancerous should be neglected. In a woman, some knowledge about the position of the uterus and possible tumors in its walls, also information about the ovaries and possible tumors of these organs can be obtained by palpation. This requires a bimanual procedure in which the doctor inserts 2 or 3 gloved fingers of one hand into the vagina and exerts deep pressure by the fingers of the other hand placed against the skin of the lower abdominal wall. He can detect the position, size, and shape of the uterus, ovaries, and related tissues as these are compressed, one at a time, between the examining fingers of his right and left hands. It is at least equally important for the doctor to see the inside, and especially the cervix of the uterus. By such observation, he can discover lacerations of the cervix which may need repair by surgery, and he can detect cervical cancers while there is still time to treat them successfully. It is early discovery and early treatment of the cancer of the cervix that have had the greatest influence in reducing the number of deaths from this dread disease. A vaginal speculum to hold the walls of the vagina apart and a simple light to illuminate its interior are all the equipment needed to enable a doctor to inspect these parts and to remove a small specimen of suspicious looking tissue for microscopic examination if that seems advisable. Inspection and palpation are the usual methods used in examining the upper and lower limbs. The doctor needs to acquaint himself with any deformities or signs of previous injuries and to check on the action of the joints. Palpation will tell him whether any sore or tender areas are present. Examination of the feet must not be overlooked. "My feet are killing me" is an all too common complaint which the patient consulting the doctor for some other reason may neglect to mention. An equally important part of the examination of the limbs is the checking of the reflexes. The one most often checked is the knee jerk. As the patient sits with the legs hanging over the edge of the examining table, the doctor gives the tendon below the kneecap a quick tap with a special rubber hammer. If this causes the leg to make an involuntary forward kick, the doctor knows that the nerves controlling the thigh muscles are in good condition. Should the involuntary jerk be abnormally vigorous, difficulty with the central nervous system is indicated. There are several other places, especially in the ankle and the elbow regions, where taps with the rubber hammer and other special manipulations will stimulate characteristic reflex actions which give important information on the condition of the central nervous system. You and your health.